Welcome to Module 1, Anxiety. Upon completion of this module, you'll be able to verbalize the meaning of anxiety. You'll also be able to describe physical and emotional manifestations of anxiety. You'll learn to understand demographic groups that are at a higher risk, and you'll be able to explain potential physical and psychological risks of having anxiety during pregnancy on the mother, on the fetus, and your newborn baby. You'll also be able to state current treatment modalities that are currently used for anxiety during pregnancy. You'll be able to explain the barriers to current treatments, and you'll also understand how meditation may be a potential treatment for anxiety during pregnancy. Anxiety is a mental health disorder that can have effects on physical health and is detrimental to social and emotional well-being. An estimated 40 million Americans suffer from anxiety, and only 1/3 receive treatment. Anxiety affects women more often than men, and it is more common during the childbearing years. Symptoms of anxiety are both physical and psychological. Physically, often patients will describe a pounding heart, heart beating fast, excessive sweating or trembling, maybe some difficulty swallowing and shortness of breath. Also, some numbness and tingling in the fingers may occur. Sometimes even nausea and vomiting, dizziness. Some psychological signs are hypervigilance. You're very, very aware of surroundings and a little paranoid about what's happening around you. Sometimes racing or unwanted thoughts. You're being driven like a motor and you can't shut off your thoughts. Irritability. Sometimes even feelings of impending doom, like something bad is going to happen. Very often patients with anxiety suffer from insomnia, inability to sleep or stay sleeping, and poor concentration on tasks that somebody has to pay attention to has also definitely been reported. Now, anxiety during pregnancy is a little bit different. So anxiety that occurs anytime is typically unwanted, but anxiety that occurs during pregnancy can have effects on the mother and the baby. Some of these effects known in the literature are increased risk of preterm labor, low birth weight, low APGAR scores. Those are the scores that are taken right as your baby is born. Those tell us how well they are coming into their new environment. There's also a variety of cognitive and psychomotor delays, including poor bonding, that have been observed. Anxiety and depression during pregnancy has been implicated as one of the strongest indicators of postpartum depression and poor establishment of the parent-infant relationship. Potential effects on the mother include inadequate nutrition and poor weight gain. If our mother is anxious, sometimes she forgets to eat or gets preoccupied with other things, maybe just loses her appetite. Substance abuse is also a potential effect of mothers with anxiety. Poor compliance with prenatal care. Sometimes mothers with anxiety forget to show up for appointments or can't make appointments. Postpartum depression, even suicide, are potential effects for mothers with anxiety. Poor mother-baby bonding that may often have lifetime effects. If a mother who's anxious during pregnancy gives birth and maybe has decreased bonding with her baby, those can last for years if help is not sought. Fetal effects and newborn baby effects from anxiety. This would be due to having a mother that had anxiety during the pregnancy. So fetal exposure to maternal hormones that are released due to unmanaged anxiety have been linked to numerous fetal effects. As you know, We all have hormones, and certainly in pregnancy there are other hormones. But hormones of stress that are released during this time have effects. So a variety of effects have been observed, including medical effects. These might be altered glucose metabolism, increased asthma, and a variety of dermatological conditions have been observed. Cognitive variations, sometimes poor emotional bonding, cognitive disorders, and even attention deficit disorders have been noted with mothers that have been anxious during pregnancy. Behavioral manifestations. Those would be signs like increased crying in your baby, restlessness, irritability, decreased ability to console your baby. And often children that start to grow a little bit older can verbalize unusual fears, fears of tasks that shouldn't be fearful in life. Very simple tasks often cause fear in these children. And in terms of biological presentation, well, we definitely know that early presentation in prenatal birth is also an effect from moms that have been anxious during pregnancy. Treatment of anxiety. Well, here's the good news. Anxiety can be treated. Both behavioral interventions and medications can be used. Medication as treatment is more complicated during pregnancy due to potential side effects. Current guidelines during pregnancy recommend behavioral interventions for mild to moderate anxiety and medications for severe anxiety. So treatment of anxiety with cognitive behavioral therapy, or CBT, this is an intervention that has been done for years with good results. It can be done in a group setting or it can be done individually. This focuses on developing coping strategies that target solving problems and changing unhelpful patterns in cognition. It works to change thoughts, beliefs, and attitudes. It then regulates behaviors and regulates emotional thoughts. The drawback to this is it can be costly, and adherence can be challenging due to the time commitment that's required. In terms of a cycle anxiety, well, how does this present itself? Well, something might happen. This could be maybe you're at now in your work environment, maybe there's a work situation, maybe there is a big meeting that's taking place internationally within a few months, and you are not sure if you're going to be able to attend as you're getting near the end of your pregnancy. Then thought might go through your mind, well, if I don't go, what's going to happen? That may transfer into an emotion. Well, now I'm fearful. Maybe I'm getting anxious and I'm fearful. Well, if I don't go, who's going to replace me? Am I going to have a job? How is this going to all work? And then maybe your behavior changes. So now maybe you're putting in more hours than you should be for this. Maybe you're avoiding other colleagues. It is negatively affecting your behavior. Treatment of anxiety can consist of different things, as we already discussed. Medications are definitely used for treatment of anxiety. During a non-pregnant state, numerous medication classes can be used to treat anxiety. However, during pregnancy, there are guidelines for specific medication classes that are known to be safer than others. Some medication classes would never be used due to well-known harmful effects on the fetus. The good news is numerous studies exist that show reduced anxiety with the practice of meditation. This can easily and safely be applied to pregnant women with anxiety. Meditation as an intervention for anxiety will now be the focus of your next module. Thank you for participating. So now, when you're ready, you're going to go on to module number 2.